Welcome to another edition of Politics and Run. I'm Egberto, who is your host. Today, we're honored to have once again Dr. Dona Kim Murphey. She's a neuroscientist, neurologist, community organizer, historian of science, race, immigration, poverty, and health. She's also the founder of Prognosus. And I tell you what, welcome to Politics Done Right. Donna, how are you doing today?
Great. It's good to be back. Thanks for having me again.
Well, look, first of all, before we get started into the nitty-gritty of what we want to talk about, tell me a little bit about this new company that you have called Prognosus, but it's spelled not I-S, but U-S. Tell me a little bit about it.
Yeah. And kind of our motto is basically that the journey with dementia is much easier with us together than I alone. And we kind of have built the company around the idea that community is really central to navigating this illness, which is fundamentally an illness that impacts not just the person living with the disease or the condition, but the family around them. And that can be biological family or chosen family, but it becomes a responsibility of other people because the people living with the disease actually become more and more dependent. They cannot live independently as the disease advances. We also are interested in the racialized health disparities in the disease because we have twice the incidence in people who are African American and 1.5 times the incidence in people who are Latino. It is Alzheimer's Disease Awareness Month in November. It is also, interestingly, National Family Caregivers Month in November. And those two things are very much related in this condition of dementia, not just Alzheimer's, which is the most common kind of dementia, but in all of the other kinds of dementia as well. And beyond the disparities that we see in incidence, I just want to mention, because I am Korean American myself, that there are disparities that we see because of language access issues, immigration status issues, other kinds of things that other marginalized or minoritized populations face in terms of access to resources that are culturally fluent, that are language specific, that are safe to access for these other communities.
You know, it's interesting because over the last several weeks, because, we're in this period of time where you have to select Medicare. It's time to switch over from Medicare to Medicare Advantage or vice versa or whatever you want to do. And I have been pointing out to a whole lot of people the dangers of Medicare Advantage and why they shouldn't follow folks trying to get them to leave their good Medicare Advantage with a good Medigap program to go into these private things. Now, the reason I brought that up to tie into what you do as far as healthcare dementia is concerned is we also know that the private sector in minimizing costs, etc., they don't treat the problems with dementia as illnesses as serious as they should.
Right.
While people that are going to the election to vote in the next day or so, they have to decide who to choose. And they have to understand that whoever they choose has a material effect, not only on themselves, but the health of their people. And if I recall, Kamala Harris has a program that fits exactly into what you've been speaking about with regards to dementia, et cetera. So why don't we talk about that and also relate it to the politics? Because I think it's extremely important that we do so.
Oh, I totally agree. This is why I thought it would be great to have this conversation with you specifically. So, a couple of things with Medicare. You're exactly right that right now is the opportunity, that open window of enrollment for Medicare. If you are on a Medicare Advantage plan, I actually highly recommend to caregivers who have loved ones with dementia that they consider switching to traditional Medicare, or parts A and B, because there is now a program that is like an innovative program through the Center for Medicare and Medicaid Services, their Center for Innovation, that is called the GUIDE model. And this model actually specifically concerns itself with not just the person who has the diagnosis of dementia who has suspected disease, but also with the person caring for them. Because as I said before, that person becomes absolutely vital to the welfare of the person who has the disease. So they recognize that and they say, look, we are going to not only pay for diagnosis and therapy, we are going to pay for care coordination, care navigation, 24/7 caregiver support. We're offering $2,500 a year of caregiver respite, which, to be honest, if you're one of the caregivers, like I'm a support caregiver to multiple people in my family, you burn through $2,500 in no time. But you know what? Something is better than nothing. And right now there is nothing. And so this new program has been rolled out as of July of this year. It's supposed to run 8 years, and then they're supposed to make an assessment as to whether, they're going to continue or expand the program. This, is under threat. Trump is always insinuating or stating explicitly that he's going to undo all kinds of, all parts of Medicare. So, yes.
Let me just say that this is not conjecture. Mike Johnson, about 4 days ago, went on and he said, when they asked about the elimination of Obamacare, the Affordable Care Act, he said yes. And then he kind of corrected himself and said, we have to make major changes, but we're removing regulations, which, as you know, means pre-existing conditions, which, as you know, a program like you're talking about, throwing that into the private sector, they are going to try to make money out of dementia, which in effect prevents that person who is caring for that dementia person from getting the resources they need for the actual care.
Absolutely. And to just give people an understanding of the magnitude of this issue, which is going to touch every single one of us. We have 7 million people impacted right now with this disease. We estimate there are 2 people for every 1 person with the disease who's involved in the care of that person. That number will more than double in the United States over the next 25 years. Everybody will know somebody and will, in all likelihood, be involved in someone's care. And this disease costs for every person with the diagnosis during the course of the illness something approaching $300,000. So it cannot be handled often by the person themselves or even their families without assistance. Right now, we're having to do all kinds of, gymnastics around how do I spend down my assets or redistribute my assets in a way that allows me to qualify for Medicaid when they look back 5 years. And yes,
we have to. That is something that bears extreme explanation here. They require you to get health care, to get the insurance from the government to lose all your assets before you qualify for anything. So you have to be poverty stricken.
Right. And, in places where they haven't expanded Medicaid, right? It's nearly impossible, right? This is what pays for nursing home care. Many people at the end of this disease, if they decide, right? Many families decide or that they can't or that they won't actually put their loved ones into nursing homes. And that's another challenge. But if they decide to put their loved ones into a nursing home setting, they have to qualify for Medicaid or often they cannot afford it. And to do that, you do have to basically, get rid of all of this person's assets. So, talk about the inability to have intergenerational wealth, for instance, right? No, you have to get rid of all of it. And this really bankrupts individuals and their families. Women who are doing most of the care, 2/3 of the caregivers are women, about 1/3 are men. They have to quit their jobs, right? They have to, make all kinds of concessions, I think, that they wouldn't ordinarily have to make in order to care for their loved ones who are aging and have this disease. It's often the case that they're also simultaneously caring for young ones in the family. So they have these multiple duties. They're considered the sandwich.
Both on the top and the bottom, their parents and their kids. So I think they call them the sandwich generation. Yeah.
Exactly. And just thinking about how that's going to impact gender disparities across the board, economic, health disparities, right? The caregivers actually suffer tremendously in terms of their own health because they neglect themselves and having to do all of this care for a loved one who requires 24/7 supervision as the disease advances. They don't have time for themselves often. So it's a huge problem. The plan that Kamala Harris has put forward for supporting caregivers is something that has been dubbed Medicare at home, right? Right now, if you qualify for Medicaid, which again, very few people do, especially in states like Texas, if you qualify, you may be able to receive some home-based services. Medicare does not support those services. So she wants to allow Medicare to actually cover that, right? So in-home support, which would be huge. Most of our families do actually choose to keep our loved ones at home. And that's kind of what is most desirable, I think, for the dignity of that individual.
Oh, yeah.
To stay where that is familiar to them, right?
Absolutely.
Yeah. So she's now proposing to actually invest in that, actually, to invest public resources into Medicare, this idea of Medicare at home that would both include those home-based services, as well as, she's tackling paid leave for family caregivers so that they can actually afford to be home and to spend that time that is important to many people with their loved ones.
So look, dementia and many other chronic illnesses will affect all of us at some point in time, whether it's your parents, your kids, or yourself. That's a statement of fact. Now, here's the interesting thing, and because we need to close out now, but here's what I want to say, Donna. Politics matters. Who you vote for matters. Whether it is, and it's not solely this election. This election is extremely important, that you vote your interests, that you vote your health, that you vote your personal economy. But it doesn't stop here. Texas is a state that doesn't accept the Medicaid expansion to the Affordable Care Act. Even though we pay for it, we don't get it because and our Republican legislature claimed to be fiscally responsible as they deny coverage and make many of their citizens die. So let's be very clear here. Your vote matters. And as Dr. Dona Murphey has said here, it is something that we have to work on. So, Donna, please give us a closing message. And I know this isn't supposed to be political, but I need you to be political, not only for the next election, but for subsequent elections, to ensure that we start getting the resources that we deserve and that we've earned out of our government.
Yeah, I mean, I just want to say to any caregiver out there, anybody who has an aging parent now, where maybe you have some suspicion that something is going on with them, this is really going to touch all of us. And we have to think about what is in the best interests of our families, right? Like political identities aside, like what is in the best interests of our families? And here, I think there is no question, right, in this case. And I have my own beef with the option that we have, right? Like on the political left, I have my own beef. And yet, I think it is absolutely critical that we support Harris in this election, and in the future, people who actually state that they will protect these, this right to healthcare, at least in some fashion, right? We still have problems with it. I know you and I, Egberto, have problems with the way it's done.
Absolutely.
But it could be better. But I think here we have an opportunity with one candidate to potentially make it better. And with the other candidate, we don't have that opportunity at all. And so I think it's clear what the choice is.
Dr. Dona Kim Murphey, founder of Prognosus, as well as a community, a great community activist. I've known her for a very long time. She is essential to our community. Thank you so kindly for having been on Politics Done Right.
Thank you so much.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.